Diarrhea is a common gastrointestinal condition in pediatrics characterized by frequent and loose or watery stools. It can be caused by various factors including infections, dietary factors, medications, and underlying medical conditions. Diarrhea can be defined as having more than 3 loose watery stools in a day. Infections, viral, bacterial, and parasitic infections are common causes of acute diarrhea in children. Examples include rotavirus, norovirus, Escherichia coli, E. coli, Salmonella, Shigella, and Giardia. Dietary factors, intolerance to certain foods or beverages, excessive fruit juice consumption, and changes in diet can lead to diarrhea. Medications, antibiotics, certain medications and supplements can disrupt the normal balance of gut bacteria and cause diarrhea. Underlying conditions, chronic conditions such as inflammatory bowel disease, IBD, celiac disease, lactose intolerance, and malabsorption syndromes can also manifest with chronic or recurrent diarrhea. Frequency and consistency. Diarrhea is characterized by frequent loose, watery, or mucousy stools. The frequency and severity can vary depending on the cause. Abdominal symptoms. Children with diarrhea may experience abdominal pain, cramps, bloating, and discomfort. Systemic symptoms. Infections causing diarrhea may be accompanied by fever, vomiting, lethargy, irritability, and poor appetite. Dehydration. Prolonged diarrhea can lead to dehydration, which may present with signs such as dry mouth, decreased urine output, sunken eyes, lethargy, and in severe cases, rapid heart rate and low blood pressure. Diagnosis. Clinical assessment. Healthcare providers assess the child's symptoms, medical history, diet, recent travel, and potential exposures to infectious agents. Stool tests. In cases of suspected infectious diarrhea, stool tests may be performed to identify the causative organism. For example, stool culture, ovea and parasite examination. Laboratory tests. Blood tests may be conducted to assess electrolyte levels, kidney function, and markers of inflammation. Management. Fluid replacement. Oral rehydration solutions, ORS, are recommended to prevent dehydration and replace lost fluids and electrolytes. Dietary modifications. Gradual reintroduction of a normal diet, avoiding irritants and addressing any dietary intolerances or allergies. Medications. Antidiarrheal medications, for example loperamide, are generally not recommended for acute infectious diarrhea in children, as they can prolong the illness and cause complications. Treatment of underlying causes. Depending on the cause of diarrhea, for example, antibiotics for bacterial infections, antiparasitic medications for parasitic infections, specific treatments may be prescribed. Output, scene script, hygiene practices. Encourage proper hand washing, especially before meals and after using the toilet to prevent the spread of infectious agents. Vaccination. Immunization against rotavirus is recommended as part of routine childhood vaccinations to prevent severe diarrhea caused by rotavirus infection. Safe food and water. Ensure that food and water sources are safe and free from contamination, especially during travel to areas with poor sanitation. It's important for parents and caregivers to monitor children with diarrhea closely